Okay, I'm wiping my table in preparation for wound care of my patient. Letting it dry. I'm going to perform hand hygiene. And I'm going to set up my tray. First and foremost, what I want to do is I want to have the patient at waist level, and I want to have my bedside table also in such a position that I can easily access my patient. And later when I need to put on my sterile gloves, I am good to go. I don't have to put them on up at the head of the bed. So I'm going to start by opening up my wound care kit and adding supplies. I've got my measuring tape here. Sometimes there's no garbage bag in kit, so I'll just set out a garbage bag here and hopefully we'll have another one inside. Begin by opening my wound care tray and create my sterile field. Often what you need to do is you need to let this fabric, this paper kind of stretch out because it always wants to flip back on you. Now I see that my forceps are here, so I'm being very careful to ensure that I'm only touching the tip of this. I've seen students grab with the forceps, but that is actually not best practice. And sometimes I'll just use my forceps to tug that down. Now I want to pass myself several supplies and add to my wound care kit. I'm placing this within my 1-inch border, and I'm opening up my garbage bag, which is nice and large in this case. I've asked my patient if it's okay to set it in their bed, and they are good with that. Again, I'm picking up my forceps because I want to grab my other metal forceps and take them out of the tray. And what I'm going to do is I'm going to grab them right here where it's bent because I have the most control. If I grab it by the tip, they tend to flip back and hit you in the hand. So I'm moving these out. I should use my advice and grab them in a secure place. Now I would like to add several supplies. I know I'm going to need new gauze. Actually, this is Curlix, not new gauze. And I'm going to even emulate what it looks like to pull it out with sterile technique. Folding back, winging back, putting this in my garbage. Again, scissors can be tricky to remove from a package, so if you grab them by the handles, that is the heaviest portion. I'm holding the winged back portion, and you'll find you'll have the most control. You'll be able to maintain a steadiness. I need a 30 ml syringe. I'm opening away from my sterile field. Slow and steady. And I'm going to add some extras just in case I need an extra couple. Cotton tip swabs here. I need my 20 gauge IV for irrigation. Because we have so many supplies, you kind of have to use several areas on your tray. At the end of the wound care, I will be putting these on top. Now, do you see how I'm opening the sticky portion and then winging back? This prevents you from having the packaging flip back. I'll put it right in the tray there. and I feel that that is enough supplies. I'll just grab my normal saline. I had that moment where I paused to consider what else I might need. This is a fresh container, and I'm going to pour my normal saline. And I am complete with setting up my tray. Some key features of the sterile field include the 1-inch border. So there's 1 inch here, here, here. Actually, the 1-inch border would cut off, as you can see, where the end of the table is. So if I were to put my forceps down, I could put them down there, but then they're at that point in the 1-inch border. Another thing to be very careful of is when you see a 1-inch border like this, we have seen students place their forceps actually right in the 1-inch border on this side, even though it's within the 1-inch border on this side. Another thing is when you are taking your supplies out of the packaging, we always want you to be considering keeping your wrists up. There's a tendency to want to drip and drop your wrists, but we have to make sure we keep our wrists up to maintain sterile technique. It's aseptic technique. This is some of the key features that we want.